common health issues affecting women, children, and men. In this video, we are going to talk about one common problem of menstruation. But in our previous video, we talked about three common questions women tend to ask about menstruation. If you haven't watched that video, kindly do watch it before or after watching this one. Today's video, we're talking about menstrual pain or menstrual cramps, or dysmenorrhea as it is clinically called. One thing women tend to complain about a lot is pain during their menses, and the perception of pain is very subjective. It tends to vary from one individual to the other. It is the most common problem women have with their periods, and more than half of women who have periods tend to get some pain around this time. Some women may just have a feeling of discomfort or heaviness in the abdomen or pelvic region. Other women experience severe cramps. The pain that you get with your menstrual period, as initially stated, is called dysmenorrhea in medical terms. We are going to stick to menstrual pain or menstrual cramps in this video. There are two types of menstrual pain. The first is primary menstrual pain, and this is the most common type of menstrual pain. Now, this is how it comes about. During menstruation, your womb contracts to bring out or expel the blood and the other products. So the pain you experience is attributed to these contractions. For most women, primary menstrual pain gets less painful as they get older, but some women tend to get severe menstrual pain. But also primary menstrual pain tends to decrease as the days go by. The second type of menstrual pain is secondary menstrual pain. Now, this is usually caused by an underlying health problem. So the pain tends to get very worse as one gets older and also lasts longer than normal. Some problems that can cause secondary menstrual pain are uterine fibroids. Fibroids are very common, and basically they are tumors or masses that grow in or on the wall of the uterus. They are almost always not cancerous. Some women with fibroids experience severe pelvic pain and vaginal bleeding, at times when they do not even have their period. We'll talk about uterine fibroids in detail in another video. Another condition that can cause secondary menstrual pain is endometriosis. So basically, endometriosis is a condition in which the tissue lining your womb, some of that tissue is implanted elsewhere, and in response to the monthly changes, just as your womb is breaking down and bleeding, that tissue that has been implanted elsewhere also tends to break down and bleed and can cause severe swelling and pain at the site. Ovarian cysts are also things that can cause secondary menstrual pain. These are just fluid-filled sacs on the ovaries. Ovarian cysts usually don't cause symptoms but can cause pain during your period or at ovulation. So one may ask, since it could be primary and normal, what should I do or when should I see a doctor? Or talk to your doctor if your pain medications are not working or helping to relieve the pain, or if the pain interferes significantly with daily activities like work or school. Also seek prompt medical attention if you have blood clots in your flow and if your flow is very heavy, and if the pain happens at times other than just before your period or during your period. It is worth noting that treatment is very subjective, or treatment varies from one individual to the other, if I should say. So the treatment depends on what is causing your pain. Therefore, you have to seek prompt medical attention if you are having any issues with the pain you're experiencing during your menses. That is it for today's video. Hope you've learned something. Don't hesitate to type your questions in the comment section below. Also like, share, subscribe, and turn on your post notification. Until next time, it's bye for now.